Okay, Paul, we're live.
Good afternoon, everybody. As always, before we get started, we want to alert our Spanish-speaking viewers that we are broadcasting a translated version of this briefing in Spanish. So, Gilbert, do you want to let them know about that?
Buenas tardes y bienvenidos a la sesión informativa donde la doctora Mase nos dará una actualización sobre el coronavirus. Esta actualización se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias.
Thank you, Gilbert. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID update for Wednesday, October 28th. I just want to remind everyone that this is a community forum and that we are inviting everyone to submit questions, and you can do so by emailing them to publicaffairs@sonoma-county.org. Once again, that's publicaffairs, one word, @sonoma-county.org. You also can leave your questions in the comments area of the Facebook Live page at the bottom of the screen, and we have staff helping to gather those and pass them along. So without further ado, let me introduce Dr. Sundari Mase, the health officer for the County of Sonoma. Dr. Mase?
Great, thank you, Paul. Hello, everybody, and thank you for joining us today. As you know, each county in California is assigned to a tier based on local COVID-19 data. And based on this week's numbers, Sonoma County remains in the purple tier. The new daily case rate per 100,000 population is 10.2. And that is a little bit from last week. This number must be lower than 7 to move to a less restrictive tier, unless we can lower our equity metric, which I'll discuss in a moment. Our county-wide test positivity rate is 5.2%, well below the 8% needed to go to the red tier. In fact, very close to being under 5%, which would meet orange tier criteria. Our equity metric testing positivity rate is 8.9%, which is above the 8% required to allow movement to a less restrictive tier at this point. But before I go further, let me just say that these metric numbers are based on a 7-day average with a 7-day lag. What that means is these numbers, which came out Tuesday, were calculated before we really implemented our enhanced strategy that we presented in the last week of testing and other great improvements in our outreach to our lower 25% in terms of socioeconomic status. So lowering our equity metric test positivity rate does offer a way to move to the red tier. Of course, one way to move to a lower tier is to meet the state benchmarks for all 3 metrics for 2 weeks. The second pathway, one that may be achieved more quickly as we test more broadly, is to meet the testing positivity benchmark and have an equity metric rate of less than 5% for 2 weeks. And this will enable us to move to the red tier, even if our case rate, that is the number of cases per 100,000 per day, is still above 7. So to achieve this and to target and provide outreach for our most hardly hit groups in the county, we have quickly tripled testing in Sonoma County. Now we have 10 recurring testing locations in targeted neighborhoods each week across the county. These locations are in Santa Rosa, Roanoke Park, Sonoma, Healdsburg, Guerneville, and Cloverdale. We'll also continue to offer pop-up testing each week based on the latest data. For example, there are pop-ups this Saturday at St. Vincent de Paul in Petaluma and the Roanoke Park Health Center. We are already exceeding our goal of more than 1,000 weekly tests. When combined with outreach from community partners, the involvement of local businesses, and a recommitment to individual safety protocols, we should see a decline in our testing positivity rates. To schedule an appointment, please call 707-565-4667 or visit SoCo Emergency Testing webpage. Again, that's 707-565-4667. I'd also like to ask you to carefully consider how you'll celebrate Halloween and Dia de los Muertos this weekend. Though many traditional activities are strongly discouraged or prohibited, there are many ways to enjoy these holidays safely. For Halloween, door-to-door trick-or-treating and trunk-or-treating are strongly discouraged because it can be difficult to maintain physical or social distancing on crowded porches and sidewalks. It's also impossible to ensure that everyone answering or coming to the door is appropriately masked, and you would be exposed to many, many different people who are not in your household. Sharing food is similarly considered an unsafe activity and discouraged. For these reasons, these activities are strongly discouraged, though we may enthusiastically encourage you to participate in other activities, such as hosting a virtual costume contest or a pumpkin carving party, creating a haunted house, or hunting for hidden treats in your own living space with members of your household, having a scary movie night or other Halloween-themed activities with members of your household, going out to Halloween-themed meals at outdoor restaurants to support our local businesses, attending outdoor events such as pumpkin carving or costume parade with no more than 12 people from no more than 3 households. With all of these outdoor activities, please remember to wear the protective face covering and remain more than 6 feet apart from others. For Day of the Dead celebrations, safer activities include preparing traditional family recipes with members of your household, playing music in your home that your deceased loved ones enjoyed, making and decorating masks or making an altar for the deceased, joining other households in an online virtual get-together celebration, observing cultural traditions, such as visiting and decorating the graves of loved ones. But if you go, please do so with no more than 12 people from 3 or fewer households. Some activities present a demonstrated risk for transmission of COVID-19 and are not permitted by state and local health orders. These include all outdoor gatherings of more than 12 people from more than 3 households, all indoor gatherings, celebrations, events, or parties with non-household members, haunted houses, carnivals, festivals, and live entertainment attractions with non-household members. Regardless of how you choose to celebrate these holidays, we can navigate this turn to colder weather if we mask up, back up, wash up, and don't let up. As a reminder for those who have elected to do their voting in person, Tuesday is the day for citizens to show up at the polls and make their voices heard. Polling places have protocol in place to make this process as safe as possible. Please follow the guidance from volunteers at each location. COVID-19 safety tips include: make your visit as brief as possible by having all of your decisions made before walking into the polling booth. Bring a black or blue ink pen. Wear a mask. Keep 6 feet apart from poll workers and other voters. Wash or sanitize hands before and after voting. Thank you. We now have a few minutes for questions from the community and from the media.
Great, thank you, Dr. Mase. Yes, so I do invite we have members of the media are here with us as well, and they're invited to raise their hand. I think we'll start with a couple of questions from the public at first. One is, why don't, wouldn't an effort to increase, this is about testing, wouldn't an effort to increase testing throughout the county in all areas result in a more accurate picture of our widespread COVID-19, how widespread COVID is here? I think that the question is focused with our new strategies. We're focusing on just those key census tracts. They're saying maybe we should be encouraging testing across the county. What do you think about that?
Yeah, we are. We've been encouraging testing all around the county all this time. And in fact, our testing numbers are well above where they need to be, even when we start. So now we are trying to focus on those census tracts and zip codes that have greater case rates and numbers, and also places where people are not actually seeking a lot of testing. So we're offering more testing where the testing is needed and encouraging the entire community to increase testing at OptumServe. Our OptumServe location has changed, one of them from Petaluma to Windsor, and we would really like to see greater numbers of people getting tested there. And Paul, you can give that information.
Yeah, I'll give the information, but we do have same day testing available in Windsor and even in Santa Rosa Fairgrounds as well for the OptumServe sites. And just a reminder, if you do want, we have, as Dr. May said, we have expanded significantly our pop-up testing. And to get an appointment for one of those sites, just call that 707-565-4667 number, and you can get an appointment at a site that's near you. Here's a question from, what about, there was a question about rapid testing. What are your thoughts on rapid testing, and why don't we have more of those available in the county?
Yeah, thanks very much. We are receiving supplies from the state, from the federal government through the state to us for a rapid antigen test called Binax Now. Now that test is available, the result will be available in 15 minutes. It requires a swab and then putting that swab into a small receptacle, and then the test reads out sort of like a pregnancy test or another rapid test with a positive or negative result within 15 minutes. That test, however, is only to be used in people who are symptomatic. So it wouldn't be for anybody who just wants to know what their test result is. So we are going to be distributing these rapid antigen tests to our healthcare partners that are seeing symptomatic people, and reserving some for public health for our testing of symptomatic contacts and other vulnerable people. So we're definitely going to be using those tests.
Great, thank you. Okay, let's take a couple of questions from our media partners. Let's go with Martin Espinoza from the Press Democrat. Martin?
Hi, Dr. Mase. Hi, Paul. So I wanted to ask about the St. Francis Assisted Living Facility. I understand that now we may have 4 deaths there. 3, this is coming from Krista Barnett Nelson, the ombudsman. And I just wanted to get a status of what's happening there. I also understand that you and Supervisor Shirley Zane, Paul Dunaway, Krista Barnett Nelson are going to have a meeting on Friday with the director of the California Department of Social Services, that's Kim Johnson. So if you could just give us an update on what's happening there at that assisted living facility. And also, if you could just talk a little bit about the status of our residential care facilities right now in terms of cases.
Yeah, so Paul, you could reach out afterwards and give specific numbers, I think. I don't know that I have the most up-to-date numbers, but Martin, we have been seeing an increase gradually in cases in our residential care facilities for the elderly. As these outbreaks decrease in our skilled nursing facilities, as they improve their infection control practices and their ability to properly cohort their residents, that kind of thing, we simultaneously are seeing more of an increase in the board and care homes, which are not patient care facilities. So we are working very closely with the Department of Social Service. They're in charge of providing recommendations, guidance, licensing, et cetera, for the residential care facilities to ensure that we're giving the same kind of care in terms of infection control, guidance, cohorting guidance, assistance, technical assistance to the RCFEs.
As a follow-up, I understand that the owners of the facility are still operating the facility, and that there was talk about bringing the management team to take over the operation of the facility. Why were these owners allowed to continue operating when they have a facility where basically everybody in the facility came down with the virus? More than 20 residents and absolutely every single staff member.
Yeah, that would be something I think probably Department of Social Service is involved with. I think that from our perspective, we're providing technical assistance for any facility that has cases, whether they're a skilled nursing facility or a residential care facility for the elderly. We take this really seriously because, as you pointed out, it's terrible and heartbreaking for the families that we have these deaths in these facilities. So from our perspective in the county, we provide technical assistance, guidance, and any support that we can.
Okay.
Okay, we have another question from the public. One, the main question is, why are we still in the purple tier and this level of lockdown when our death rate is so low? Dr. Mase, you want to talk about that?
Yes, actually, so, the metrics have changed from the state of California, and it's the state of California that determines which tier a county is in. And that number of deaths, early on, the state was using that as potentially one of the metrics to determine how much we could reopen. That's no longer part of the metrics. There are three metrics. One is the new cases per day per 100,000. The second is the test positivity percentage overall in the county. And the third is a test positivity percentage in the lowest 25% census tracts in the county. So those are only three things that our status is based on. And the numbers, as I said just recently, are not after we put into place our enhanced testing partnerships, financial relief packages, the financial stipend for people to come in to get tested, and our community outreach and education. That hasn't actually had effect yet on our metrics.
Another question, which related to Martin's question earlier, are we including the Sniff skilled nursing facility numbers in our community count? And if we are, should this affect our tier if it is essentially in a contained environment?
Yeah, it's a very good question, actually. We are including those because actually the skilled nursing facility cases and the residential care facility cases are probably directly related to community transmission. Because although they're occurring in a contained congregate setting, COVID got into that setting somehow. And it's gonna largely be by an employee or staff member that didn't know that they had COVID that came into the facility and started the situation in that facility. So it's actually a direct marker of community transmission. And so we're in the purple tier because there is widespread community transmission, which then is reflected by the outbreaks in these kind of congregate settings.
Thank you for explaining that. Let's go to Julie Johnson from the Press Democrat. Julie?
Hi, thanks so much. Dr. Mase, I'm wondering, I'm working on a story where I'm supposed to sort of describe where we're at, generally speaking. And I'm wondering, there was this rise in August and cases started going down in December. And it seems, just looking at the data, that we're now in this more consistent pattern. And I was hoping you could explain sort of the basis for that increase in August, and then sort of what has happened since then and what you think it means about where we're going.
Yeah, I mean, I think you're pointing out the trends in COVID-19 over time, and those trends are affected by many, many different factors. So one would be directly what potential outbreaks are happening. So in August, we were seeing, I believe, a lot of cases in our congregate settings, like the skilled nursing facilities. And we were seeing large outbreaks amongst agricultural workers, essential workers, and dairies, wineries, vineyards, et cetera, farm workers. And then we had a lot of other discrete outbreaks that were happening in different sectors. And I think as we got greater control of the outbreaks in the skilled nursing facilities, as we began to do much more outreach and testing in the farm worker group, that all had an impact in potentially decreasing cases. Now, of course, there's the fires and the evacuations, and it's hard sometimes to really pinpoint to what extent that affected our cases. We did see an increase in cases after the Walbridge fire, and we were able to attribute at least 15 cases, and likely there were more that were undetected due to the evacuation. Now with the glass fire, we may start seeing an increase in cases because a lot more people evacuated secondary to that fire. So given all of the multiple things that affect our case numbers and rates, it's hard to really say it's one thing, but You got to take everything into account.
Yeah, thank you. I'm wondering how sales and services sector fits into this picture. Looking at our employment sector data, 18%, that represents the biggest chunk of cases. And I'm wondering if that is sort of a newer area where you're seeing outbreaks, or how that community is fitting into this trend.
Well, we did go to opening indoor retail. I'm trying to remember when that was. I think it would have been in July sometime. I'm not sure if I can pinpoint that, but I do have Kate Pack on the line from our epidemiology group. And I'm wondering whether, Kate, you want to say anything about the sales and services or trends in that area. And if we don't have that data right on hand, we can always get it to you through Paul. But I don't know, Kate, if you wanted to add anything.
Yes, we sales and services has been one of the categories that we've seen throughout. That's a big contributor to cases. It tends to be workers in retail stores, restaurants, and as Dr. Mase said, if you'd like more specific breakdowns, we can follow up with you after the call to give you a little bit more specifics around the breakdowns that we're seeing in the service and sales sector.
That would be great. Thank you.
Okay, let's go to Chris Smith. Chris, you there?
Hello, can you hear me?
You're on.
Hello, hey, thank you. Dr. Mase, I was just hoping you might to ask you if you could advise parents who are determined to take their youngsters out on Halloween night, and and also residents of Sonoma County who would like to leave something out for trick-or-treaters. What would you say to them, or please? And thank you.
Well, thanks. You know, both the county as well as the state have guidance out for Halloween. And both of these guidance documents highly recommend not participating in door-to-door trick-or-treating, trunk or treating, where kids go from car to car, or in, giving out candy in that manner, or whatever else, apples, whatever people want to give, because COVID, we know, can be transmitted through objects. And that's why we use all the hand sanitizer and all the hygiene. And therefore, there is definitely a much higher risk of COVID transmission through leaving candy out. I mean, and the fact that people can be asymptomatic with COVID and not even know that they have it may contribute to that. So even though you think it's safe, if there is a risk associated, I would highly advise this year against those activities. And I really think we as a community should focus on the longer goal right now of reopening our schools for in-person learning, reopening some of our business sectors that are suffering, such as restaurants and other facilities for indoor activities. And that's where we need to focus right now, I think, rather than looking at that Halloween night as a one holiday for us.
Thank you.
Okay, this is we have a question here. Can you explain, Dr. Mase, why we're seeing that only schools receiving waivers so far are private schools?
Yeah.
Can you address that?
Yeah, because the majority of the waivers we received are from private schools. And Dr. Harrington, who's our superintendent of schools, is working really closely with the public schools, and they're kind of all on the same page and are moving towards the time when they can actually reopen not just K through 6, but K through 12 for in-person or hybrid models of education as we move in. So it's really private schools that have submitted waivers largely.
If I might
we should
add
point
something.
out that the
Yeah, Adam, please go ahead.
Yeah.
So Kashaya School is the only public school that applied for a waiver, and they withdrew it. So the only applications we currently have are from private schools.
Thank you, Adam. That's Adam Radke, our Deputy County Counsel. And Adam, I know we have an update on that front concerning school waivers. Could you, this might be a good time for you to give that if you can.
Yes. So on Monday, we forwarded St. John the Baptist School to CDPH with a recommendation for approval. And on Tuesday, we submitted Summerfield Waldorf to CDPH with a recommendation for approval. And then I believe we still have about 2 more schools where we're seeking clarification and updates to their reopening plans as part of this ongoing process. But there may be more submitted to the school within the week.
Okay, so that's St. John the Baptist and Summerfield Waldorf that have both been forwarded to the state with recommend to approve their waivers. Okay, let's go to Joe Vasquez from KPIX. Joe, you have a question?
Hi, Dr. Mase, it's Joe Vasquez. Hey, so I understand you're targeting particular census tracts, and I think that means largely the Latino community and underserved communities that are testing disproportionately positive, if I have that right. And so here's the problem in those communities, of course. A lot of them live together, and there are also other people in the household working. How, in a nutshell, is the county going to solve that issue? There is a limited supply of housing. And of course, that is an area that you've got to get past to move out of the purple, right?
Yeah, thanks for that question. And you're right, the overlap between the lower 25% in terms of lowest quartile, lowest 25% in terms of census tracts does largely overlap with the Latinx population, but includes other populations too in some percentage. I don't know exact percentage. So you're 100% correct that living in crowded conditions, large households, and a lot of transmission within those households is a big factor in our case numbers. So what we are doing is to find other hotels that can serve as alternate care sites that are close to the census tracts, close to home for people. Right now, our alternate care site is in Healdsburg, and it is far away for people who may want to isolate or quarantine away from family if they're living in Santa Rosa, Petaluma, or other places. So we're trying to contract up to 35 different hotels in different areas of the county to make it much easier for people to isolate or quarantine, depending on whether their cases or contacts. So as soon as we identify someone as a case, which also through all this pop-up testing should be much quicker than if we weren't doing all the outreach and testing. Once we find someone who's a case, we are immediately offering them a place to go outside of home so they don't continue to expose either their families or whomever they're living with, their farm workers, that they don't expose other coworkers that they are residing with, that kind of thing. And we're also going to be offering a small cash bonus of $50 for people who choose to go to the alternate care site. And this would be over and above the $1,216 financial stimulus that we're giving to cover for lost wages and all during the isolation period.
Just want to make sure I hear you right. You're still working on getting those hotels.
We're working on contracting those hotels, and we had discussion with our tourism industry asking them to help us find places that are willing to contract with us.
Thank you.
Okay, on that note, we do have quite a number of questions related to why we're still in the purple, Dr. Mase. And I think we should probably just address that. And basically, one of the questions is why are we different than our neighboring counties? I know you've covered that a lot, but it might be helpful to our viewers if you go over that again.
Yeah, sure. I mean, there's a lot of things that set us apart from our neighboring counties, definitely from the Bay Area counties that are south of us, like San Francisco and Contra Costa, Alameda, et cetera. We have a much more agrarian-based industry, and we have a lot of people who work on farms or dairies or wineries, vineyards, and there have been big outbreaks in that group, and they are much more disproportionately affected by COVID. So that sets us apart. And then we have tourism, and that's a hard one to track, but we are a destination actually for our neighboring counties. So that's another reason that puts us potentially in a higher case rate in terms of comparison with other counties. We also are doing a lot of testing, a lot of public testing, which is really good for the county because we're able to find our cases and get them isolated and our contacts quarantined and tested. But we are then also having a higher case number or rate because we're finding our cases, which is a good thing that will help us in the long run. So I presented some data maybe a month ago comparing us with Monterey County, which is demographically and in terms of industry and agriculture and farm workers and all of those factors much more like us. Monterey and Sonoma have the same sort of population and demographic breakdown as well. And we are both currently still in the purple for those reasons. But again, the new expanded strategy that we just have rolled out and started implementing as of last week, which will take some weeks to come into effect, is I think gonna really have a positive impact on our COVID situation.
And I want to just dovetail on something that you discussed earlier. I just want to make clear that those who do test positive are and they need help in being isolated from their home situation. We're finding them that support now, whether it's through our ACS alternate care site or some other. I mean, we're finding them locations to be properly quarantined. Right? I mean, just to clarify that point.
Oh yes, we're offering that right now. It's just that we have one location, and we had the Sonoma State University dorms before that was also one location. So we have been providing an alternate care site probably for months now, but we're going to expand that, that's all.
Yeah, and we just want to make sure those who do test positive know those resources are available to them. Okay, let's go back. Martin, you have a follow-up question?
I got a couple. The first one is about Healdsburg Hospital. Can you give us an update on what, there was a massive testing done there on Monday. And, you guys can...
Yeah, I think Healdsburg Hospital put out their own press release announcing that they do have, I think they said 12 cases as of Sunday, and they did a enormous amount of testing of staff per our recommendation in collaboration with the county. We recommended that they test everybody's staff as well as their patients or longer term subacute residents as well. That testing is now still pending. We should have results later today, and I'm sure Healdsburg Hospital will update their results as soon as they have them in.
Okay, so you're saying later today, because I know you guys can do those, turn around those tests in 24 hours.
Yeah, it's 24 to 48 hours. It was a large volume of tests, so I'm hoping we'll have results by later today.
Another question I have is when you were talking about the equity metric and all the testing that you've done, we've had about a week now of this ramped up expanded testing. It sounds like you're already seeing some positive results in terms of positivity for our disadvantaged communities. What can you share with us at this point?
Yeah, I mean, ramping up testing, we have ramped up testing, but again, remember that we're doing it in a phased manner. So in a few weeks from now, by let's say mid-November, in the last 2 weeks of November, we should really be hitting our target of closer to 500 tests a day. So we're finding more cases, and our test positivity potentially could even go up a little bit initially, depending on the numbers of cases we find. But that's a good thing, because then we'll be able to find people who are asymptomatic and get them out of the community, decreasing community spread. I don't know, Kate, if you have the exact numbers. You know, we were in transition last week of doing some of our more scheduled outbreak testing and the pop-ups. But did you have more of a breakdown as our numbers, Kate?
In terms of the numbers of tests performed, or
Right, the numbers
Um,
of tests, especially in those pop-ups in that area. I know we had really good turnouts in many of our pop-ups.
Right, and I think Paul, you had, I think, referred to some of those numbers in a previous press briefing. I wanted to note around the testing, as you were saying earlier, we use a 7-day lag in looking at the metrics. So a lot of that work we're not really seeing yet in terms of the impact. I do have reports on the number of tests per testing site that could be shared after this call, if that's of interest to you, Martin, for some of that pop-up information, but I don't have that right in front of me.
Yeah, that would be fine.
Yeah, you can share that with me, Kate, and I'll be happy to pass that along to whoever would like that information.
Great.
Okay, let's go to Julie Johnson. Julie, you have a follow-up?
I do, thank you. Dr. Mase, I wanted to ask you what the biggest challenge has been with contact tracing.
Yeah, contact tracing is a really resource-intensive process. That is why the county, we have close to 100 persons performing contact tracing right now. And first of all, we need to be able to identify through a case interview everybody who's been in close contact with the person who has COVID. And right there's a challenge because the person has to want to tell us everybody they've been in contact with. And there are instances where we don't get full disclosure in terms of everybody that the person came into contact with because they don't want others to know that they have COVID, or it's a work site that they don't want to notify, so there's some challenges there. Then once all of the line list of people who are contacts is given to us, or we're able to get those names and all the information, we have to contact each one of those people, tell them that they're a contact of someone with COVID, ask them all the questions about whether they have symptoms or not, determine, where they are, tell them that they need to quarantine in their home for 14 days, that they'll be tested at the end of that quarantine period around day 12. And then we follow up with these individuals a couple of times during that 14 days. Someone is calling them, seeing how they are, making sure that they're getting everything they need during the quarantine period. And then we have to get everybody in to get tested at the end of the quarantine period. So it's kind of a long process. You can see that during that process, there's many places where there could be lapses in terms of identifying or following up, getting people tested, that kind of thing. And we'd like to be as much 100% complete as possible.
What, if you had to put a percentage on it, what percentage of cases you feel get an appropriate level of contact tracing, the depth of knowledge you want to have, what percentage do you think we're at, and what do you think would be reasonable to expect?
Yeah, I don't know, Kate, do you have some more specifics on the percentage of cases that have full case interviews and contacts elicited, that kind of thing? I think it's an average of 2 to 3 contacts per case, right?
Yeah, so we typically, see about 3 contacts per case elicited, but there is about, I would say, 20 to 30% of cases where the information is not as full as we would like to see for the case interview, for the reasons that were mentioned, that the interviewee declines to be interviewed or is hesitant to provide specific details.
And even though that average is 3, the range could be anywhere from 0 to 30 contacts per case, really. So it just depends on the situation, whether it's a work site or a household and that sort of thing. So there are definitely challenges.
Thank you, yeah.
Dr. Mase, we have one question from Antoinette. She asks, why should we get a flu vaccine when the insert says it makes you more likely to get other respiratory illnesses?
The flu vaccine should not make you more likely to get other respiratory illnesses. You may have a mild reaction to the influenza vaccine. Maybe you may feel soreness at the injection site for a day or two. You might have, very limited respiratory symptoms as a reaction to the influenza vaccine, but nothing like what you'd get if you actually got influenza. It's a very safe vaccine. Even those people who have egg allergy can now get a form of the vaccine that doesn't contain any egg-based materials in the vaccine. So it's a very safe, effective, good vaccine to take that will likely prevent you from getting really sick with influenza. So I think I highly recommend it, and there's no data to suggest that it makes you more vulnerable to anything.
That's great. Thank you. We have another question about mental health concerns in our county, and there was a summit, a large conference of education leaders yesterday about what the impact on our students, and we're seeing an increasing number of failing grades, and just a real concern about their mental health going forward. Do you have some thoughts on that, and how soon we might be able to get them back in school?
Yeah, I mean, we really want to get our kids back in school for either a hybrid model or in-person learning. And I think with all the mitigation factors, of course, that the state has put out, Dr. Harrington and I are working very closely. Dr. Harrington is our superintendent of schools, to try to get there. In the purple tier, per the governor's order, we cannot go back to in-person learning. And I absolutely worry about and acknowledge that it does have a toll on students and parents and staff in schools. And, our goal is all the same, to get there. So what I would like to really encourage is that every single person in this community do what's best in terms of mitigation measures for yourself, your family, your community. Wear the facial coverings or masks. Practice the social or physical distancing. Use hygiene measures and use them as often as you can. And do not have large gatherings of people, or any gatherings really, if you can help it, outside of your household. And let's be safe with Halloween and the Day of the Dead celebration coming up. Let's be very safe in the ways that I've outlined, because absolutely we care about the mental health of our students and parents, and need to get back to hybrid or in-person learning.
And we also want to let our viewers know that, as we mentioned before, there is a warm line that's set up by the County of Sonoma, for those who are just dealing some with mental health or any issues they'd like to just to have somebody to talk to. And this is not just for adults, it's for those of any ages. And we just encourage you to call the number, which is 707-565-2652. That's 707-565-2652. And there are people standing by to take your call. Let's go
I do
to
think,
Martin.
Paul, that Adam had one quick correction to make about the school waivers.
Okay.
Yes, I do apologize when I misspoke. A Liberty school did apply for a waiver, and they are a public school. So I misspoke when I said that no public schools applied for a waiver. But the emphasis is from the question about why we're only seeing private school waivers approved. The emphasis was that the vast majority, the clear majority of the waivers that have been applied are from private schools. And we are working with Liberty School, and we did submit feedback to them regarding their application. So I do wish to make that correction.
Yeah, and I believe Liberty School is a charter school down in Petaluma. So thank you for clarifying that, Adam. Martin, did you have a final question?
Yeah, I wanted to sort of ask, follow up on a question that Julie posed about contact tracing. See the county's website that there were, on the question of race and ethnicity, there's a lot of unknowns.
Martin, we're having a hard time hearing you. Could you speak up a little bit? Sorry.
On the in the question of race and ethnicity, there are quite a few unknowns. 2,000 of our cases. Also, the under investigation and count in by source, that's around 37%. Do you think this is like largely because of non-cooperation?
Largely because of what you cut out there?
Because people are not cooperating when you're asking them questions. And also, is that common in other counties, or do we have just a larger share of people who are not cooperating?
Did you say something about another county? I cut out there for a sec.
I asked if this is common in other counties.
Okay.
Do they also have a large number of people who don't cooperate?
Yeah. Yeah, actually, let me have Kate answer this, because Kate, you know that the state has statistics on the number of unknown responses to the race ethnicity question. I think it's similar, right?
Yes, the unknown race ethnicity is similar. It's something that the state is looking at across counties, encouraging counties to, gather as complete of information in that area as possible, recognizing the challenges to gathering that information at times. But it's something that Sonoma County and all counties are working on, increasing the percentage of known race ethnicity data.
Yeah, it's 24% in Sonoma, and I think it's pretty similar at the state level, suggesting that probably all counties are facing that. People have to be willing to give that information to us, as well as the information about identifying their contacts, or underlying medical illnesses, or even when their symptoms were. We are relying on people to tell us where they've been, whether they've had gatherings, have they been to a restaurant or elsewhere. So a lot of data that we collect depends completely on people giving us the information.
And if they don't, does that fall into the under investigation category?
I don't know. Kate, do you know whether the under investigation is people we haven't completed the information on, right?
Right. Under investigation means that the interviews and the contact tracing is still in progress, and that case hasn't been closed yet.
Yeah.
Thank you.
Okay, and Deborah, did you have a question for us?
Hi, yes, I know you're about to wrap up, but if you wouldn't mind just revisiting the Healdsburg Hospital situation for a moment. I'm interested in how you compare and contrast that with the outbreak at Memorial, and how concerned are you that medical setting outbreaks will slow the county's progress towards the next tier? How big of a factor are they?
Well, we're still performing a contact investigation. And so I really don't at this point have all the details from Healdsburg. And so it's hard to compare that to anything else until we have more information. But I agree that at Memorial, for example, that the fact that they did have an outbreak among their staff, that they actually did a fantastic job of addressing by testing staff at day 1, 5, 14, and then retesting them again at the end of all that to ensure that they found every single person who was a case and got them isolated and made sure that everybody who was a contact was quarantined, tested patients. So it was a really great response. These kinds of situations are going to occur, and we need to rapidly respond and ensure that we are doing the best to create a safe environment for staff in these healthcare settings, as well as patients.
Thanks.
Okay, we're coming up on the bottom of the hour, and so we're gonna wrap it here. I just want to thank everybody. I do want to. I promised to get the phone number for those who are interested in getting tests. For those who are interested in getting tests at one of our OptumServe sites, which we now have set up in Windsor at the Bluebird Center on Bluebird Drive in the town of Windsor. And we also have OptumServe at the Sonoma County Fairgrounds in Santa Rosa. That number is 1-888-634-1123. It's 1-888-634-1123. And those who want to take advantage of one of the pop-up sites that we have available that have doubled around the county, more than doubled, That number is 707-565-4667. I want to thank everybody again for being here, and thank you to all our producers and interpreters for being here. And we will see you again next Wednesday at 3:30. Thank you all.
Thank you.